Hi, everyone. If you're just joining, you are here for a preemption and online forum this afternoon. We will get started shortly. Some other folks who join us in the audience. My name is Serena Unrein, and I'm with the Arizona Partnership for Healthy Communities. And we're so glad that you're here today. If you want to drop your name in the chat and tell us you're interested in about our panelists today, let us know who all is here in the audience. And just so you know, we can see you, or you can see us. We can't see you. So the only thing that'll on the screen today are the panelists, and we won't be able to see you or hear you. You are an important part of the conversation. I hope that you will be joining us in the chat, letting us know your thoughts, your questions, and our panelists will be answering those questions throughout this 1-hour webinar. And we'll get started in just another minute or two to allow people to join. If you just joined us, you can see us, but we cannot see you. You're a key part of the conversation, and please ask us questions in the chat. And once again, we'll get started in just a minute. Glad to see some familiar names in the chat. Very excited to have you all joining us this afternoon. And if you're just now joining us, I want you to be part of the conversation. Let us know who you are and what you'd like to hear the panelists discuss this afternoon. It's really nice to see people from across Arizona, and glad to have you here for this really important conversation. And we'll get started in just a moment or two. We'll also be recording this afternoon's conversations. So if you want to share this with some of your colleagues or come back and reference any of the points our panelists make at another date, if you registered for this webinar, and you did because you're here in this room, we will be sending that link out to everyone who registered today. So let's go and get started. Thank you all for taking the time this afternoon to join us for this online conversation about preemption and public health. My name is Serena Unrein, and I'm the director of the Arizona Partnership for Healthy Communities. And we are so excited to be hosting this conversation this afternoon with the American Heart Association. And we're really grateful to these panelists for sharing their time and expertise about the important topic about how preemption impacts public health. So some of you might have heard this a few times already, but a few important notes. You can see us, but we cannot see you. So you'll be able to hear our faces and hear our voices. And even though we can't see or hear you, you are an important part of the conversation. We'll be answering audience questions throughout this 1-hour webinar. So if you have a question, you have thoughts, please just drop them into the chat. We know what's top of mind to you, and our panelists can be sure to address that. We'll also be recording this and sending out the link to everyone who registered for this. So if you want to share this with any of your colleagues, we'd be so grateful. I'd also like to make sure that I take some time before we get into these first few questions to introduce our 3 panelists, because they are really experts, and it's with their time and expertise that we are having this afternoon conversation. So first we have Councilor Lauren Kuby from the city of Tempe. Thanks for being here today. We have Petra Morrison from the American Heart Association here in Arizona, and we have Will Humble with the Arizona Public Health Association joining us this afternoon. So first, we're going to get started, and we're going to talk about what preemption is. And we are lucky enough to have Petra Morrison here to get us started, tell us a little bit more what preemption actually is.
Hi, so my name's Petra Morrison, just as Serena mentioned. We're here to talk about preemption, and it's a bit of a tricky thing to kind of tackle in just a matter of a couple of sentences, but I'm going to try. Preemption, in plain terms, is when a larger form of government, such as the state, limits a smaller form of government, such as a city or town, from taking action on an issue. Preemption has the ability to set a standard or set a boundary. State governments have needed to step in and create laws that set a minimum standard that local leadership must meet. This is referred to as floor preemption. And while it sets a minimum standard, it allows a city or town to do more to protect the health of its citizens and to promote equity. People believe that states should set a uniform minimum set of standards, and that cities should be able to build upon these policies and pass improvements that reflect the needs of their local communities. And unfortunately, preemption is being abused at the state level by corporate lobbyists who are creating boundaries referred to as ceiling preemption, which prohibits communities and their leadership from being able to address their unique needs. Preemption is a type of policy that can set standards and has done so in the past, but lately it's being abused and only ever setting boundaries with which corporate lobbyists are drawing the line. And the truth is that many cities and towns have these unique needs that need to be addressed, and they've elected these officials. And now these elections, these local elections, are being circumvented by these corporate lobbyists. And the truth is that many of these cities and towns also have less ability to address these needs now than they did at the beginning of last year. And the disparities regarding health are exacerbated by preemption. Being exacerbated by preemption at the state level, this COVID-19 pandemic has illuminated the dynamic shifts of power among the state over local leadership.
Petra, for taking the time to explain what pre is. And I know this is a topic, like you said, that's becoming more common now than it has been a few years ago. And sorry if cutting in and out, it's telling me that my internet connection is unstable, so my apologies. So I'd like to turn it over to Councilmember Lauren Kuby from City of Tempe to talk about why this is a topic that we're seeing now more than we have in the past and some of the impacts that has on cities in Arizona.
Thank you, Serena. It might be good if you take yourself off audio because that can eat up a lot of bandwidth. I'm sorry, off video. That's great. And if you could share the first slide, please. So you mentioned, Petra, about preemption and how it's a trend, a national trend. It's a national to local trend, unfortunately. The National League of Cities, a group that I belong to and that I really get some of my spinach from, has just released Principles of Home Rule for the 21st century. And in that they go through an exhaustive history of home rule across the US. They talk about current landscapes, current trends, and they also offer model constitutional language that states can adopt and legal strategies they can adopt to fight preemption. Next slide. But let's talk about the Arizona context, because many of us across the country like to think of Arizona as the poster child for preemption. We're not the only state that's preempted, certainly, but we are kind of a poster child. But Arizona has a long-standing preemption history, and you can trace it back to 1919 when the courts ruled in favor of cities on regulating utility rates. And then for about the next 100 years or so, the struggles related more on what things should be regulated. Should a city regulate or should a state regulate a certain issue? Next slide, please. So a more sinister trend emerged. After the recession, the legislature really began using preemption bills to restrict a lot of revenue sources from cities. You couldn't have a tax, but every an even year at elections on November, and they tried to fill their own budget gaps with the city's pockets, which is an unfortunate trend. We saw that with HERF funds for sure. And but by 2014, we really saw a more hostile form of preemption beginning, and lobbyists and special interests requesting specialized legislation in response to activism and activist sentiment and practice that were taking place on councils, especially councils in Tempe and in Tucson and in Flagstaff and obviously Phoenix. And recently they preempted inclusionary zoning. You probably all know that cities cannot require a developer to either build a certain percentage of affordable housing, even 10%, or even put it into a fund. Like, that is actually forbidden for a city to do that. And that's such an important tool that cities have across the country to create affordable housing. They put a ban on plastic bag bans, and they put a ban on energy benchmarking, on apprenticeship programs. And ... Next slide, please. The mother of all preemption bills emerged. And I had to put a picture of Boggs, Mr. Biggs, Andy Biggs there, who led in the legislature at that time. And he's been such a negative force and he's embraced so much corporate interest. But we have a bill called SB 1487. And just merely mentioning that, you feel a chill go over city councils, because under 1487, passed in 2016, any single legislator can complain to the Attorney General of Arizona that a city is in violation of state law. And then the Attorney General has to complete an investigation within 30 days. Next slide. And here we go. And then, sorry, this may be blocked for you, but then the Attorney General has three options. One, he can say there's no violation. That doesn't happen very often. He will say it may violate, and then he will give that decision to the state Supreme Court, who has to give precedence to that case over all other cases, and hopefully will do that within 30 days. And then the city is required to post a bond equal to 6 months of their state share revenue. That is a huge, huge amount. So he could also just say it does violate the state constitution, and then the city has to resolve it within 30 days, or technically they could lose their state share revenue. However, that's never happened. No city in the 20 or so preemption cases that have happened has the city had to do that. So there seems to be a leeway. The state Supreme Court does not seem eager to take away state share revenue, and they give cities the I wouldn't say the ability, but there seems to be this unwritten rule that they'll let cities take 30 days to rescind. But what does this mean, SB 1487? What it really equates to is it's a chilling of the body politic, of our city decision-making. I can't tell you how many times we've considered actions that haven't even gone past the working group stage, because in City of Tempe, we worry about our state share revenue. We have to be responsible to our residents, but this has a chilling effect. And when you want to be a city that innovates, when you want to be a city like Tempe that makes waves in the desert, when you want to percolate progress and show and embrace innovation that Arizona State University models in our country, and we have ASU in Tempe, we're sometimes stymied from that. And that's where the problem comes. So next slide, and this is the last slide, and then we'll get into more informal discussion. But I wanted you all to know that a lot of states really envy Tempe, envy Arizona, because we actually have a charter city home rule authority, and that gives, under the Arizona Constitution, 19 cities in Arizona the ability to regulate issues with if there's local interest in mind. Now that has been winnowed down over the past 5 or so years. It's very disturbing, but we do have this charter city idea. And then the Voter Protection Act, which was Prop 105 in 1998, it changed the Arizona Constitution, and it enabled cities and residents to pass referendums or ballot initiatives. And the only way the legislature could change that ballot initiative is if they keep the same mindset for that. They have to keep the intent of the bill, but they need 2/3 majority in both houses in order to change it. And the governor, if he vetoes it, they need a 3/4 to amend. So that has been a strength that Arizona's had. So we've been able to pass earned sick days and increase the minimum wage. And we've been able to pass very progressive legislation because of the strengths that we have. But still, preemption is very debilitating to cities and has a chilling effect over our body politic. Thank you. Now let's get into the talking discussion part.
Thanks for that very helpful overview. So I think that we've had a few questions already show up about what some examples are of how preemption has impacted health. And we've had several examples in the last year. So I'd like to turn it over to Will to talk about some of the things that we've seen with preemption and public health recently.
Thank you, Lauren. That was, Petra, you too. Those are really good summaries of overview of preemption. And I'm going to do some editorial stuff, before I get into my comments. Number one, Lauren, you mentioned Andy Biggs as part of that bill, and you're right, he's the sponsor. But don't forget, that year in the state of the state, the governor made a big deal about saying in his state of the state that his top priority included getting rid of the authority in cities which they're charter cities, as you mentioned. His priority in the state of the state that year, 2016, was to get rid of cities' innovation. And he specifically said, and the punishments need to go up to and include
That's right.
restricting shared revenue. And I think it was Kirk Adams, who was still his chief of staff at the time. They were thick as thieves with Biggs, and they got him to run that bill.
Right.
And so next time you give that presentation, you might put Mr. Clean up there, because
You're
he
right.
did this.
And I should mention, Will, that Tempe's action, I was working at the time on a earned sick day initiative for our city, because 48% of our residents didn't have earned sick days. And it was really directly leveled against earned sick day legislation that Tempe was working on as well.
Yeah, that's right. And I want to do one more editorial thing, and I want to touch on COVID for just a bit. I've always found it ironic, although I'm used to hypocrisy these days, but I've always found it ironic that the very politicians who rail against the federal government for preempting state government on doing things are the exact same politicians who are they're enthusiasts about stealing the authority of counties and cities, which are rightfully there in the state's constitution. And that's why they have to find these creative measures like 1487, because these are charter cities. So these cities can do this stuff. They can be innovative, like have tobacco 21 laws, or before Proposition 206, which is the Smoke Free Arizona Act. Cities were doing smoke-free laws, and Tempe included, and so they could do it, but they have to find a creative way to compel cities not to do it, even though they can. And that's why the 8th and 9th floor cooked up this idea of getting rid of cities' shared state revenue as really what's the right way? Extortion. Well, it's not exactly extortion, but there's a right word that I can't think of right now. But it's they hold a gun to the city's head and say, "You try it, and we'll take away your state shared revenue." I think it's just, I just think it's outrageous. And in the end, and you mentioned voter initiatives. In the end, I think, like many issues in this state, it's going to be up to doing a voter initiative to undo that bill. And I think we could get the majority of Arizonans to go in for it, but it's just a matter of getting the critical mass together to get that voter initiative passed and through the state legislature. And there's not a day that goes by that I don't thank the very first governor of the state of Arizona he held up statehood for like 6 months, I think, so that he would be ensured that the voter initiative process was built into the state's constitution. It was actually tied, incidentally, because he wanted to make sure judges that we voted for judges, in the ballot box, as opposed to having them be appointed. Well, so that we could review judges. But voter initiatives was part of that as well. And if you think back, I'm diverting a little bit, but if you think back at some of the very most progressive things in terms of public health, not all, but many of them have been voter initiatives. Prop 204, which expanded Medicaid up to 100% of federal poverty. That was a voter initiative by the late Andy Nichols and his team down there in Tucson. The Smoke Free Arizona Act in 2006. Many cities have put those in place, including Tempe and Flagstaff, and I think even Mesa, before that voter initiative went through. More recently, was this Medical Marijuana Act, regardless of what your opinion is on that in terms of benefit to public health. So that's something that never could have passed never even got a hearing, at the state legislature. And finally, Prop 206, was it 206? The minimum wage law from a couple of years ago. It's 206, wasn't it? That's kind of thing that would never have gotten a hearing down at the state legislature. And yet the voters saw the light. And finally, I'll talk about 207 from this year, the retail marijuana initiative, which I look at more as criminal justice reform. That's why I voted yes. I'm not an enthusiast for the retail stores, but I am very enthusiastic about criminal justice reform. That's the only way to get it done. So I diverted a little bit of attention there. But let me talk more about preemption, and I'll just highlight another kind of preemption, which happens through executive orders. And we've seen that to lethal effect this year. When the COVID-19 pandemic first started, there were a series of executive orders issued by the governor, and the cornerstone of many of those voter initiatives were preemption. You look at the bottom of almost all of those executive orders, and there's preemption in it every single time. And we have many city councils and county governments that would have put in place sensible, evidence-based public health interventions to slow the spread of COVID-19, but were prohibited from doing so by the governor's executive orders. And some of those had lethal effects. Some people point to the face covering mandates that are in place in many jurisdictions in Arizona and wonder how that happened. I'll just give you a brief overview of how that all happened. As I mentioned, the initial executive orders all prohibited cities and counties from doing any public health interventions over and above what the governor decides in his executive orders from the very beginning. And that included restrictions on bars, restaurants, nightclubs, curfews, capacity limits, you name it. Nothing could be done. That included face covering ordinances. And as the month of June wore on, and we went into explosive exponential growth of this virus, and our hospitals began filling up, the governor finally relented and allowed cities and counties to do one intervention. They're still prohibited from doing everything else, but they were allowed to do one thing, which is to put a county or city face covering ordinance in place. And to show you the diligence of pretty much, not every, but the majority of city councils and county supervisors, as soon as they were finally given the authority to put a face covering ordinance in place, pretty much all of them, Lauren, you probably noticed yours within minutes. The city of Tempe, you have to notice the vote, on council. But they noticed they had the ordinance probably in a template, and they noticed those, and I think they were voting on them within 36 hours, I think, and had those face covering ordinances in place. And the reason that those face coverings ordinances never happened earlier is specifically because the governor had preempted cities and counties from doing anything evidence-based or otherwise to mitigate the COVID-19 pandemic. And those restrictions are still in place, except for the face coverings. So, we have thousands of people that have now died in Arizona. And some of that is the direct responsibility of the governor, who tied the hands of local governments throughout this entire pandemic and prevented them from putting together evidence-based policy interventions that could have saved lives. So this isn't just some theoretical, like, this is a bad idea preemption. It's lethal, and it killed people this year. And Serena, you might be sorry you invited me on here, but I feel really passionate about this because there have been lives lost because of this.
I had this you're saying, and I really appreciate your leadership on this issue, because I hear that being dead is bad for your health. So if these decisions are lethal, then I think we need to be able to point to some of the causes, some of the decision making that has or hasn't happened. And so thank you for your candor and for being here. And I'm sure. Go ahead.
Because on December 3rd, Dr. Kara Christ, under the supervision of the governor, basically changed the goalposts, because previously, if the three benchmarks were in this substantial, the red category, we could revert back to the closing of bars and the closing of indoor dining. But that was removed as a possibility on on December 3rd, even though it was supposed to be, we were supposed to return to that status. So that has just been very detrimental to the public health as well, and has resulted in people dying.
I just want to say this, and then we could go to Q&A. I don't know how they can live with themselves. I really don't.
I'm again, thanks for everyone being willing to say the hard things and to point out how to have some real, these decisions and preemption has a real impact on people's ability to be healthy and live well. And one of the comments that came up in the chat to the panelists, and I think this is a really good point and a really recent example, it was from Barbara Burkholder about fireworks and talking about how Maricopa County experiences severe exceedances of PM 2.5 every New Year's Eve because the fireworks lobbyists convinced the legislature to preempt counties and localities from stiffer regulations. And I know that we all saw how the air quality was right around New Year's. And Will, I think you made the point that it might have been a burn day here in Maricopa County, but it was not a no fireworks day.
Yeah, I know. Isn't that ironic that, you know, it's a no burn day? They anticipated the no burn day. It wasn't based on meteorology. It's based on, you know, if everyone burns their fireplace on Christmas and New Year's Eve, then we got a big problem. But they totally ignore and can't do anything about the fireworks. And the fireworks create PM1. It's measured as PM 2.5, but PM1, that's particulate matter that's 1 micron in size. And what that means is when you inhale something like PM1, it goes all the way down into your alveoli, that's your air sac. And that is what's the very most damaging part of particulate air pollution is PM1. And fireworks specifically generate PM1. But preemption is there, and therefore if people light off fireworks with impunity, but you can't light your fireplace.
If I could speak to that, we've received so many complaints and it's a continual source of frustration. And I think about fireworks. I want to be the first city in Arizona that has noiseless fireworks, which actually are more bright and more intense. They just don't make the noise. And these fireworks have been innovated in Italy, and I'd love to see that happen in Tempe. But as far as fireworks, we have, you know, we can't regulate the sale or the use of fireworks. And you can blast off fireworks from December 24th to January 3rd. Why can't we restrict that and make it be December 31st from, you know, 8 o'clock until midnight? Why can't we restrict the time you can purchase them? It's ridiculous. There's 3 times a year where you can use them around the 4th of July, and May 4th through May 6th, June 24th through July 6th. That's a huge time frame. And as far as public health, it's not just about air quality, it's about our mental health. You know, we have veterans with PTSD that suffer from firework displays and firework use in neighborhoods. And we have pets. We know in Tempe, this is a horrible story, but 2 pets escaped a home and were shot in the head by a resident who felt threatened by the dogs, and he killed 2 dogs, put 4 or 5 bullets in each dog. I mean, that's an extreme example, but I have a close friend who's been having a terrible time, has to give her dog Xanax, and the dogs are just beside themselves. And this really impacts our mental health, our sleep. I mean, and all for the fun of blasting our fireworks. I don't see why a city shouldn't be able to limit it to a certain number of hours on 1 day or 2 days of the year.
I completely agree with all of that. And I'm so glad that you brought up the PTSD issue and the animal issue, because I was just telling Serena recently that I had my holiday break. I totally expected to get plenty of sleep. And for the entire time, fireworks were going off every single night in my neighborhood. And I thought, I'm going to go ahead, I'm going to talk to my city council members. And then I think it was either you or Will had posted something on Twitter, which I hardly am ever on there. And I looked and I saw, wait a second, this is preempted too. So the lack of sleep, the exhaustion, and I think a lot about a lot of the friends and family that I have who served, who are suffering from PTSD. And of course, the animals that I've foster and take care of here in my home. It is debilitating knowing that I can't do anything about it, and that my local leaders can't do anything about this either.
But I don't want to, you know, also cities are responsible for enforcement, and we need to be better at patrolling neighborhoods. And, you know, aerial photographs are illegal, period, across Arizona, aerial photographs. So we, photographs, fireworks, I'm sorry. So we need to, we can obviously give tickets for that, but we can also be a little proactive in doing a neighborhood, you know, beat, having the police just troll around and see if there's incidents reported and take action, because oftentimes people are violating and launching aerial fireworks, which are not allowed.
Well, great points all around. And I think I want to shift the conversation back to a bit of basics on preemption, just because of some of the comments that we're seeing in the chat. So I'll be turning over to Petra in a moment to talk about some of 2 types of preemption that she had discussed earlier on. And then someone also made the point asking about what state shared revenue is and why it's so important to cities and how it's determined. So Petra, maybe if you want to talk a little more the 2 types of preemption and whether preemption can be good or if it's always negative. And then maybe we'll turn it back to Councilmember Kuby to talk about how state shared revenue impacts cities.
Fantastic question. And I really do want to emphasize that, you know, preemption in and of itself, it's policy. And it's not inherently bad. It's not inherently good. It's those who wield it. And unfortunately, we have, you know, we have some really great local leaders and we have some really great representatives. However, they may not fully comprehend or understand that this is actually impacting communities' health day in and day out. That simple little line of words actually really can negatively impact the outcomes of millions of people. I think back to, and I'd love to hear Will's point of view on this, I think back to the stay-at-home order, right? This is a great example that a lot of folks are aware of. There was preemption in that line. There was limiting preemption. You saw this happen where cities and towns who had stronger restrictions, where they saw it was necessary, were then unable to keep those restrictions. Now, just imagine if the stay-at-home order had been more of a floor preemption, where this is a statewide stay-at-home order. These are our minimal requirements, and any city or town who feels the need to go above and beyond in places where there are high populations like Maricopa County, as opposed to say like Duncan or St. John's, Arizona, where not a lot of folks know where those are at. I know where they are at. They're very rural and they do have their own very unique health disparities. But imagine how helpful that would have been for them who have like a very small population versus somewhere in Phoenix or Chandler or Tempe who really needed to go above and beyond it. So that's the example of the good kind of preemption that could have happened last year versus the not good kind of preemption that happened last year. And then we think about those consequences. You know, we saw them in real time. A lot of us here may have lost loved ones. I know I've lost a lot of family members in the past 12 months. And it's crippling to understand like that we're not having this conversation enough with our neighbors, with our local leaders, at our PTA meetings, at our school councils, I should say, our city councils and so on. So it's these examples that, you know, you just think about it and you go, okay, this is not good. Why is it not good? How can we make it better? And again, those standards are really something that I'm really sad that we didn't get to see that happen last year. It was limiting. So, Will, I'd love to hear your point of view on that.
Well, and thank you for making that distinction, because preemption can be good, and having a baseline public health standards would be an excellent an excellent illustration of that. And what's sort of clear to me, though, is that the dangers of preemption are when you have corporate interests, not the residents, not the voters, not even the representatives writing the legislation. And that happens at ALEC, the American Legislative Exchange Council, in their bi-yearly meetings. And as a young councilman, I wasn't young, but as a new council member, I went to an ALEC meeting. I paid my own way, and I was working for an organization trying to uncover ALEC. So I was photographing the agendas in the bathroom and sending them to this organization, because they keep it all so secretive. Because at those meetings, they're basically handing out the legislation that these legislators will just pick up and draft. And it's all driven, in the case of plastic bags, it's the plastic industry, it's American Chemistry Council. These aren't thoughtful public policy positions. They're picking up corporate interests and carrying their weight in the legislature. And you wanted me to mention about state share revenue and what that is. I don't want to get too wonky, but basically the state uses a formula based on the latest census information, and they share income tax, and that's called urban revenue sharing. They share income tax, the state transaction privilege tax, TPT, so sales tax, vehicle license tax, and highway user revenue funds with the cities. And that's apportioned out, based on the population of each city. So this threat to take away state share revenue can amount to a quarter of a city's budget. It can be even more crucial to a rural area, a rural town that doesn't have the opportunity to have like as much bed tax, say, or other kinds of sales tax come in. And it can be devastating. It has not yet happened with SB 1487. It's sort of the stick approach, and it's this threat that is always there. And I can tell you from conversations I have with city colleagues, that is their chief worry, that we're going to have our state shared revenue taken away. If that happens in COVID times, that could be a deep concern. Of course, that's the whole point, right? They want us to be frightened. They want us to be chilled and try not to innovate.
Yeah, I don't have anything to add. You guys have those sort of like right on target. Great, really nice job.
Well, and someone's pointing out, you talked about corporate interests, that David Gowan works for a fireworks manufacturing company, and he's lobbied for that company. And now he's been leadership in the legislature. So you can see direct ties from all of these bills to corporate interests and the legislators who accept their donations and contributions.
Great questions all around. Thanks to everyone who's either sent questions directly to the panelists or put them in the audience. We definitely want to make sure that we're addressing whatever it is that you want us to discuss this afternoon. So keep those questions coming, and we'll do our best to address any questions as possible. And what we can't get to today, we will try to follow up with you on via email. I saw a question a little while ago, and I think this is going probably on a lot of people's minds. What can be done about this? So what is being done already to combat preemption, and what can either individual Arizonans do about it, or what can groups and organizations who are interested and see the need to tackle preemption, how can they get involved? So any of the panelists who want to address that, hop right in.
There are a lot of organizations that are actually addressing preemption. They've been addressing preemption for a long, long time. And in the past 10 years, it's been incredibly just seemingly insurmountable. I think there's a graph that I have one of the slides for more recently showing how, the past decade, these ALEC bills have really exacerbated these inequities that we see with regards to health. You'll see this is from the Local Solution Support Center, which Lauren had mentioned earlier. This is just a really nice example. I mean, I feel like this is just a really telling graph right here, showing that we've got gig economy preemption, minimum wage preemption, soda taxes, which we actually have in Arizona. It's a food tax preemption. Fair scheduling, which I know a lot of folks aren't familiar with. I have had a lot of jobs where, I've had to literally work till 11 p.m. and then be up again at like 1 a.m. to be in for my shift, or I'm working with a ton of heavy machinery in a matter of hours. And that's not that's actually like preempted. And these things they continue to drive these inequities. We have a lot of organizations in Arizona. If you look at, I'm going to just say it, Lucha is absolutely incredible. Lucha and ACE, the Living United for Change Arizona, and the Arizona Center for Empowerment are absolutely incredible at tackling a lot of this, and grassroots organization around it is fantastic. And of course, the AHA cares about this. We have our Voices for Healthy Kids initiative, which is, why we're talking about this today. It negatively and disproportionately impacts Black and Indigenous people of color, specifically Black women and their children. We really need to support these working families. We need to empower them. And secondly, I'd really like to emphasize how I think a lot of folks who work in health, such as like me, having gone to school for exercise physiology and kinesiology, you know, you look at how we're treating these individuals on a regular basis, helping them overcome these diabetes diagnoses or this surgery that they recently had or this injury that they had on their job. And I think about that and I thought, why are they getting sick in the first place? Why are they getting injured in the first place? Is it because they were exhausted? Because they had an awful turnaround just like I had the other day where I had to go in for PT because my neck is hurting and, you know, now I have a slip disc because of my job. I think we need to start looking at these upstream issues, these upstream solutions. And I know they're not easy. I know Dr. Davis Strong is on the call who absolutely empowered me to do this kind of work actually. These upstream solutions that really aren't easy to come by, but we go a lot further together. So if you're interested in becoming more active in this, feel free to email me. I mean, I'll give my email out. Serena, you can put it in the email chat if you'd like. I could do it later as well. And be sure to talk about this with your local leadership. You know, you have a voice. Use that. If you live in Chandler like I do, go ahead, talk to the city council. I've been there. I go talk to your neighbors about it. Lauren just put her own email in there as well. And definitely talk to those that you work with. If you're working in the healthcare field, think about everything Will has mentioned today. Think about how this pandemic has really impacted your work. Think about how so many people on the front lines are experiencing PTSD from this overwhelming situation that we're all experiencing right now. So please start thinking about why it is these people are getting sick and why it is folks are, you know, experiencing cardiovascular disease and diabetes and having to get lung transplants because of things like tobacco or vaping. So absolutely look into your local leadership and talk to your neighbors, talk to your coworkers, and feel free to email me and I can put you in touch with some folks that we know.
Yeah, and ASU is quite a resource as well. We have the Center for Urban Innovation and Dr. David Swindell leads that, and he's published a report and offers a lot of resources for elected officials and citizens and looking at the preemption challenges. And you should know, at the city of Tempe, for one, we keep a mailing list of any residents that want to stay in tune with what's happening with the state legislature and preemption. So when there's an issue that comes up that affects us deeply, we can have those residents write in and call legislators, not just their own legislators, but it's often really important to tell those personal stories to the legislature so they understand that the corporate special interests that they're representing aren't necessarily the best interests of their residents that they represent. So that's very important. And then nationally, the Local Solutions Support Center, and I put the link in there, is just a profoundly good organization. And we have weekly meetings every week. We sometimes skip for holidays, but we have the Kresge Foundation, Robert J. Wood, we have Partnership for Healthy Families. We have every organization you can imagine, all allies in this fight. And in Arizona, it's Lucha and the State Information Exchange and different council members and mayors. And we get together and we hear about what are the latest challenges you're facing. And when your city, your state has become a focus of a preemption battle, there are like ants that come in and help us with it, or worker bees that kind of help us to tackle and deal with the situation, get us attention and get us legal help. There's a group of lawyers led by Nestor Davidson, Professor Nestor Davidson back east, and they help us with our legal challenges as well. So we're really on top of this issue, but it's like whack-a-mole. There's so many issues that are popping up all over the country.
You know, Serena, I know I'm not the host, but I'd like to ask Lauren a question. Have you been, you know, like this, have you like had a discussion with the League of Cities and Towns or some entity like that about running a voter initiative to get around all this stuff and finance the signatures and just, you know, take it to them toe to toe that way?
Yeah, you know, the National League of Cities is proactive and engaged. You know, I don't want to throw our Arizona League of Cities under the bus, but there isn't as much of an urgency with the Arizona League of Cities. And, you know, for example, we have the best the best equal pay program in the country. Tempe does. And I've wanted to do a presentation on it at the league meeting in Arizona for years, but that's always just, you know, declined, turned down. They're not necessarily on the cusp of being proactive like that. So it's frustrating to me. And we know ballot initiatives are tremendously costly, and the legislature's been throwing a lot of roadblocks in the whole ballot initiative process. So while I'd like to say we should do that, I don't think it's going to happen until we have a Democratic legislature and Democratic governor. I think that's the only way it's going to happen, short of enormous costs that would have to be held and carried by a lot of national organizations, because I don't think.
And then you could, and at that point, you could run a referendum.
Yeah.
And then so you could get past a future legislature that would try to undo
That's
and
the
put
best.
in a new.
That's
Yeah.
the best. But the league does fight individual issues. Like we have a preemption. We can't regulate short-term vacation rentals, Airbnb. And that can be an existential threat to some neighborhoods where, cities and towns like Sedona and Tempe, they're facing enormous affordable housing problems. We're faced with having a lot of our housing stock going out of commission because Airbnb is picking it up. So, and private investors are investing in Airbnb and not renting out their properties. So, that's an issue that Arizona League of Cities is focused on. They want to try and amend that and refer to more local control. And there's also a prominent Republican I'm working with who wants to amend the firework preemption. So we'll see where we go with that. But I don't think there's an appetite statewide amongst all the cities and towns to do this. There is with the cities maybe, but a lot of the towns aren't as interested.
Councilmember Kuby, I'm glad that you brought up the short-term rentals, because I think one of the topics that we continue to hear so much about is housing and the need for more affordable housing in Arizona, and its ties to how that impacts health. So I think there are a couple of preemption examples, from inclusionary zoning to short-term rentals to even rent control that we have in Arizona. So if one of you wants to talk a little bit more about how housing and preemption are tied, or some of the preemptions in Arizona that impact housing and what that impact on health is, I think that might be of interest to our audience as well.
Yeah, we know how important housing is to healthy communities, to healthy neighborhoods, to healthy individuals. You can't be, if you don't have housing security, you're not gonna be happy and stable. So this inclusionary zoning law, I know it sounds wonky to describe it that way, but that's how it's referenced. Inclusionary zoning is a profound tool that is available to so many cities. And so when I have developers come and say, well, we can't do affordable housing there, it doesn't pencil out. I think, how does it pencil out in Chicago, where they're allowed to have inclusionary zoning? It always kind of strikes me as humorous. But inclusionary zoning preemption means that we cannot require a developer to build even 10% affordable housing. And then there's times where we're giving them bonuses of density and height, where we try and make that a requirement. And then we have the Goldwater Institute breathing down our neck saying, oh, you can't even give the hint that it's tied to affordable housing, this increase in density and bonus. You can't even do that. So they're trying to restrict it even further. And it's been devastating. So we have to, when building affordable housing in our city, we have to focus on land that we have, that we can control. And then there's much more leeway.
It's really just taking a tool out of the toolbox for a locality to try to best solve some of the issues that their communities are seeing when preempt laws like that.
And another tool in the toolbox was the Affordable Housing Trust Fund in Arizona. And at one point it was at 55 million. And then it was completely raided, I think, for state highway patrol, I believe. So this is, in a way, it's a preemption, right? They're preempting our funding stream. And there's been a lot more talk about replenishing that fund. And last year, I think $15 million was put in the state share, was put in the Affordable Housing Trust Fund, but it was all dictated to go to rural towns that were represented by conservative legislators, and it became like a pork barrel issue. It was so sad. So there's a lot of people in the housing advocates in the housing community that really want to see that fund replenished this year.
I know a lot of our partners at the Arizona Housing Coalition and a bunch of other groups are doing some great work on that. So very grateful for their leadership. I wanted to turn it back to Petra because I feel like one topic that we haven't touched as much on this afternoon is equity and some of the impacts on just on marginalized populations and some and how preemption impact communities that are most in need of some health support and resources are impacted by preemption. So I don't know if you have some thoughts you'd like to share on that, but I wanted to make sure that we touched on that this afternoon.
Yeah, of course. So it's fascinating. I mean, it's policy. I mean, policy is going to impact us whether we think it's going to or not. I always think of how the cell always wants homeostasis. Of course, I go back to that kind of science thing, but I think about how we have so much information that's coming at us, whether we think we're, receptive to it or not. But if you have, neighborhoods that are historically have been redlined, that are still, housing the same families generation after generation without having any sort of resources or representation going to these communities, they'll continue to have, incomplete streets or poor lighting, things that actually increase safety, promote physical activity, access to green spaces, which I'm incredibly passionate about, access to physical activity in green spaces. And then we think about how just in general, preemption itself, I mean, you have this ability to set a standard or a boundary. And we've seen a lot of boundaries being set by preemption in the past couple of years, where they're trying to create, anti-sanctuary city. They've got anti-sanctuary city preemption, or they'll have bathroom ban preemption, that kind of stuff. And this is really harmful to children. This is really harmful to know that the greatest equalizer in America, an educational system that's for these children to go learn, take in information, be their healthiest selves, is being under attack by policy. And this disproportionately affects, Black and Indigenous people of color, and it also impacts LGBT plus youth. And so when we talk about health justice, and we talk about health inequities, preemption is of no exception. I mean, this is exacerbating a lot of those health inequities that, we're fully aware of when it comes to women suffering from cardiovascular disease, Black men in America having shorter life, one of the shortest lifespans out of all of our citizens. And we think about how cardiovascular disease disproportionately impacts Black women. So preemption, a lot of folks keep going, oh, policy, it doesn't affect me that much. But you think about stressors, you think about just simple stressors that build upon one another over and over and over and over again. And we've neglected it for so long. And we have a real opportunity to address those issues at a local level, where you will see a mom who's been very proactive in her school's, parent-teacher alliance group go, you know what, I'm going to go and run for city council because we've got issues in my neighborhood and I want to address that. But even if we did elect her, it's her ability to serve that community is being circumvented and cut off by corporations at the state level. And this is by design, unfortunately.
Thanks for sharing that, Petra. It's important. I think it's really important to remember the real impacts that preemption has on people's lives and how it impacts Arizonans each day. We have about 5 or 6 minutes left, so I wanted to give each of you a chance to share any final thoughts or any sort of action steps you'd like the audience to take. So if they want to learn more or get further involved with your work, they can do that. And if you have anything that you want people to leave with this afternoon, I want to make sure that we're giving you each a little bit of time. And we have a question about from the audience, what is one thing each of us could have the most impact to fix this? So that is a fabulous question. Thank you, Laura, for asking that. Lauren, I think if it will start with you.
One thing I could do would be to change the legislature, and we're obviously going to have a new governor in 2022. I think we need to have a governor that recognizes that local decision making is decision making that is closest to the people, And there's a whole host of laws that we need to revisit and repeal, once we do change that leadership. But I'm also aware that it may not happen in 2022. We're playing the long game, and we've seen some real, some forward progress in Arizona, and most notably in the presidential elections. But I think we have to change our leadership. We have to have people do their jobs and not represent the corporate interests. One of the reasons why I switched a lot of my focus in my city efforts to getting rid of dirty money out of elections is because I think money is the root of all evil. I think that, and that's one area where the state Supreme Court has said that cities have the right to regulate the method and manner of their local elections. So I worked hard to reduce our campaign limits from $6,250 to $500 and reduce PAC limits from unlimited to 10,000 total. And to also require that dark money interests, if they spend money on elections, they now have to reveal their original sources. So I think it's all about shining the light that people have a right to know. And I do believe in my heart, when people know and they what's revealed to them, when they see who's behind this legislation, they're repelled by it. So I think we have to be more transparent, and then we have to allow people's will to be expressed at the ballot box and in ballot initiatives.
Thank you so much for sharing, council members. So you heard it here, campaign finance reform is how we get to some preemption solutions, and how it's also a public health issue. So, all right, I'll turn it over to Will, Director of the Arizona Public Health Association. Thanks, Will.
So, yeah, I think you asked for an action plan, or call to action for everybody who's listening. One thing you could do is, whatever your personal professional interests are, join a nonprofit organization that focuses on the kind of advocacy that you support, and stay active in that organization and help them financially and stay involved. And when they issue action alerts for different things during the legislative session, follow up on those things. Another thing you could do is for sure know who your state legislators are, and get to know them and send them, regardless of party or whether you think that they are sympathetic to your cause. Email them, call them, get to know them before legislative session starts and in the interim period, because once session starts, they're just so busy, there's not a lot of time to pay that much attention. But get to know your state legislator, even if they're at a different party than you are. And when there is you'll see, sign up for their email list, and they'll say, I'll be at Einstein Bagels on Saturday from 8 a.m. to 10 a.m. or something like that. Go and do that. And even if you didn't vote for that person, go there so that they know who you are, and have a nice conversation with them. And then when you email them during the legislative session about an issue, they'll remember who you are. So a lot of progress that you can make in all these areas has to do with what? Relationships. So focus on relationships with decision makers, whether they're elected or appointed, and cultivate those over time. And that's the short game, I would say. The long game is what Lauren just said, is we got to change the leadership in the state. And we got to find a candidate for governor in 2 years that is electable, who's competent, who's smart, who gets the issues that we're talking about, and has the best interests of the people in mind, not corporations. And that candidate is out there somewhere, but it's really important to have the right candidate. So that's the long game.
Well, you've given people some things to do in the short term and the long term. So thank you for that. And final thoughts, Petra.
I would say a combination of those things. I wouldn't necessarily say we have to completely change up the makeup of the state legislature. We do have some really great people there that are actually fully aware of this work. I mean, I'm not going to name names, but there are some folks up there that are aware of what preemption is. But I just know that we need to inform whoever does decide to run for positions that they should know that preemption's a thing, and that they will be targeted by dark money, and that they need to think about why they're running. I mean, we're there for public protection, infrastructure, and public health. Those are really important tenets of being a civil servant, being a steward in your local and state communities. And on an individual level, I completely agree with you, Will. I think that knowing what you're passionate about, finding those resources. I mean, I think Civic Engagement Beyond Voting is an absolute awesome organization to like, they call it the gateway. I think they call it like, I think that's the word they call it, is the gateway drug of participation. They get folks involved in the RTS system. And I think things like knowing who your representatives are, knowing who your council members are, knowing that those are your spaces, everything that's in your city and town, those are your spaces. Make your face known, talk about these issues, get to know them. You'll find that a lot of your city council members are actually very proactive, like Lauren, for example, who really actually care about what's going on in your neighborhood. And they very well are actually very familiar with it because they might actually live in your neighborhood. So yeah, I'd say a combination of the two things.
I just wanted to thank everyone for joining us this afternoon. If you've been a part of the audience, you've been a key part of the conversation. We really appreciate your thoughtful comments and excellent questions. And we'll be sure to send everyone who registered for this event today a recording of this conversation. So if you have other questions for us, you can be sure to reply email and we'll get back to you. And I just wanted to thank the American Heart Association for your partner for this webinar. Of course, thank you, Councilmember Kuby, Will Humble, and Petra Morrison for sharing your thought and expertise so generously with all of us this afternoon. And we look forward to seeing you all on our next webinar. Thank you, everyone.
Great, and can the panelists stay on?
I think I have to, let me see. Sure, we'll stay on for one moment so we can take a picture. Everyone else is still here too, so.
And I would love to be able to see the chat because there's so many great questions in there. I'd like to be able to reach out to some people that sent some information.
Great. I have the chat saved. So I'll go ahead and end the webinar, and thanks everyone for being here. Thanks to the panelists and to the audience.